This is because we did it.
Mushamanio uyu gatagati ga Kanju ya magavana na ministry ya ugima wa mwiri urari wa kwaririria maundu ngurani makugacirithia motungata sector-ini no. Gatagati ka maria maraiguithanirio ni guteanirio gwa tabarira ya ministry ya ugima wa mwiri ya kugura macini cia urigitani, tabarira iria yambiriirio mwaka-ini wa 2015 na matanya ma gutigirira thibitari igiri hari o county ni ciagwatira macini igiri cia gikiro kia iguru.
And we should be able to liaise with it.
Tabarira no riu iritafanagio ni thirikari riu igikuithio ugiririki wa gutigirira thibitari cia county ni ciagira na macini iria irabatarania.
That all pending issues on medical equipment and related services deployed by the national government in counties have been agreed upon by the two levels of government. Intergovernmental participation agreements, IPAs, have been executed between the Ministry of Health and individual county governments.
Now on a new level where our interest is the service to the people, as long as the national government is providing the equipment. And we are convinced beyond any reasonable doubts that we have done the right decision. That is why we have signed today, because we need the equipment irrespective of the model of engagement with the vendors.
Akiaria thutha wa mucamanio uyu muikariri giti wa kamiti ya ugima wa mwiri thiini wa Kanju ya magavana Muthomi Njuki ni atugiritie ikinya riri akiuga ni maratanya kugacira kwa motungata ma urigitani thibitari-ini ciothe guothe bururi-ini.
As counties, as we are consumers, the agreement between the national government and the vendors is something they have already put in place, and they are satisfied that it is a good relationship. Otherwise, they would not have had us to sign the agreements today.
Finally, we have now executed the IPS, and that moving forward, the noise that has been around on the medical managed equipment services, that has been put to an end. And as a ministry, we have been given the mandate by the governors to proceed and get into service level agreements that shall ensure that services are provided at the county facilities.
Minister wa ugima wa mwiri Susan Nahumicha ni yeranirie ati thirikari no iguthie na mbere gukinyaniria motungata kuri muingi ta uria yeraniire.
The rollout of universal health coverage, which was the promise that His Excellency the President gave. So we are good to go from here, and the ministry is ready. We start rollout in annex.
Mwenaini wake muikariri giti wa Kanju ya magavana MWIRI na Kenya tariria uria ikiro ciothe cia thibitari iria mukagira kigina kuma kuri thirikari niguo gukinyaniria mihango ya umuthenya ari hamwe na urigitani.
The funding for level 1 and 2 and 3 facilities will be financed through a public finance mechanism and individual capitation. Level 4 and 5 hospitals will be financed through social health insurance. Further, level 6 will be financed through a critical illness fund and social health insurance. The actors, Ministry of Health, NHIF, and county governments.
Hadwini Hakameme TV, Jitagogena, Wawaduro.